The 5 terms I chose to define were electronic health records, hardware, HIPAA, nursing informatics, and telehealth. These 5 terms are very much related and used every day in my healthcare organization. Electronic health records are electronic records that can document different encounters a patient has throughout a health system. It can include doctor's visits, lab visits, even hospital stays. The purpose of this is to provide seamless, safe patient care by involving every provider or caregiver that is involved in that patient's care. In my practicum organization, they use electronic health records throughout their entire system, which includes 5 states. It is very helpful to be able to see previous visits during the pregnancy and maybe different testing or things provided which benefit the patient but also cut down on cost of repeated testing. Hardware is what makes up the computer that displays the electronic health record. Hardware can also be used to describe orthopedic devices such as hip and knee replacements. We use different forms of hardware throughout healthcare every single day. Hardware, simply put, would be parts and pieces that make something. An example of hardware in my practicum setting would be the hardware that makes up our fetal monitoring system. It is an ultrasound and a TOCO transducer that measure uterine activity and fetal heart rate. Without these pieces of hardware, it would be more difficult to do our job. HIPAA was the next term I defined. HIPAA is vitally important to organizations, but to our patients. HIPAA is a privacy rule that is in place to protect health information. HIPAA states that you should not share protected health information to anyone other than those directly involved in caring for that patient. That includes not leaving information open at the nurse's station or having charts out and available for anyone passing by to see. It is also important to be aware of your surroundings when talking about a patient's history or their testing. HIPAA is well known to everyone in every aspect of healthcare. It is used daily in every department, and there are serious consequences if it is not respected. Nursing informatics is the process of integrating nursing and the information that you obtain from caring for patients and/or combining it with communication, technology, and management of data. The purpose and goal of Nursing Informatics Nurse would be to provide more patient-centered care and taking those data points and looking into trends. In my practicum organization, Nursing Informatics Specialists work closely with staff and leadership to use technology to create a safer and more patient-centered environment. They facilitate training and manage data, looking at trends and process improvements. The last term I defined was telehealth and is perhaps one of my favorite advances in technology thus far. Telehealth is the delivery of health services via some form of technology. It could be with a computer and a camera so that the doctor can talk face-to-face with a patient or even another doctor. It could be a phone call consult between 2 physicians. The purpose of this is to provide access to care that otherwise may not have been able to take place. We use telehealth quite a bit at my current organization. We are a very small rural facility and we do not have an in-house neurologist, pulmonologist, and even pediatrics. We use telehealth to get important consults done and to also assist if we need to transfer a patient out to maybe a larger facility to better meet their needs. We use telehealth also with our long-term care facilities, and this is something that we started here at our facility and has grown popularity with our other health systems. So when a patient is going to be discharged to rehab or long-term care, we do a face-to-face handoff with the patient, the current nurse, and the receiving nurse. This gives everyone the chance to ask questions and to have the patient involved also. We have found our patients feel much more comfortable because they see a familiar face when they arrive to their destination.